It's really exciting to be here with this group, and Elizabeth and Andre, as you were walking through the list of previous presenters, it really is a great set of presentations that you've all had the opportunity to hear, and I wish I'd had the opportunity to hear some of them too, because they sound like they'll be really great, and it sounds like you're getting a really good big picture view of the state of affairs in Canada. So we're going to give you a bit of sort of the state of affairs from our perspective, but really would love to make this a discussion, and would love to hear questions and have a bit of a discussion and a debate today about where we are and where we need to go from here, because there's lots to do in the coming years, and lots of work for all of us to take on to move this agenda forward. So I wanted to open just with a few comments that were in the mandate letter given to the federal health minister, that just gives a bit of a sense of the place we are today in terms of the priority around digital health informatics, health data, and you'll see references to the importance of access to care, to the virtualization of care, citizen access to services, to information, and the need for a world-class health data system. And so this is really exciting to see for those of us that have worked in this space for a while, because it's a reflection of the importance of this work as an underpinning to a great health system. And I think we're all aware that the pandemic has been a big deal in shifting this landscape. So, at InfoWay, our work took on a huge emphasis on care virtualization in the early days of the pandemic. And that's a story which we won't entirely be telling today, but I'm very happy to dive into. But then, of course, becomes the really important questions that emerged from the challenges that we had as a health system to get the data that we needed to make day-to-day decisions that were being made about capacity and triaging and access to laboratory and things like that. So many really important data questions emerged. And that's where we'll spend most of our time focusing, because we really want to talk about what's the sort of underpinning for data science and artificial intelligence going forward. I'm going to give you kind of a big picture view, and then Bobby will take you a bit into the weeds around some of the work that we do at InfoWay that tries to inform this work. So the next slide is just a bit about our organization. If you're not familiar with InfoWay, we are a federally funded independent organization. We are not for profit. Our members are the deputy ministers of health for the provinces, territories, and federal government. So we essentially serve all of the health systems in the country and exist at their pleasure. And really that sets the foundation for our mandate, which has been broad mandates from the federal government to advance digital health. But the essence of it is that we need to work very closely with our membership, which is the provinces and territories and the federal government, to move things forward hand in hand. So hopefully what you'll take away from some of this is our role as a convener and a collaborator to try and build common vision and move the country together forward. The next slide speaks to the mandates that we've had over time. So initial mandates, and this starts back in around 2001 when our organization was founded, were all about building infrastructure. So those of you who have been around in this space for a while, and I can see from the call that there are at least a handful of folks that might recall back in the early 2000s, InfoWay's work was substantially about building core elements of the electronic health record. And we had what we called the EHR blueprint, which basically was the concept that you want to digitize core elements of of person's health information, so their lab history, their diagnostic images, their medications, allergies, immunizations, discharge summaries, and some of those keynotes, and make them broadly available. And a lot of that requires investment in things like standards and core infrastructure that will be able to get that information. So that was a huge portion of the early mandate of InfoWay. Then we moved on to providing tools that actually support clinicians. So huge emphasis on electronic medical records, lots of investment in terms of community medical records, ambulatory medical records, and a lot of emphasis on things like telehealth. A big push to try and make things like video visits remote monitoring and things like that, things that were available across the country, if not massively used, at least available. And then more recently, Prescribe It has been a big focus for our organization. Prescribe It is the National Electronic Prescribing Service. And then following that, and some of these waves overlap, obviously, as Prescribe It is very much a going concern. But following that, the emphasis shifted to consumers, giving Canadians access to services and access to their own information that allows them to take control and as we all know, generate a lot of value for themselves and for the health system. So that's broadly what InfoWay has been doing over this time period. Many nuances to that, but would love to dive into that history for anybody that wants to ask questions or discuss it. So the next couple of slides then, what I wanted to do is give a bit of a frame for where the digital health world is. And, from the lens of, data science and artificial intelligence, it's all about what data is out there that we can use and do interesting things with. And so if we think about a snapshot of what the world looked like in 2002, obviously we just been through a big internet bubble. The internet was substantially available. Digitization was the norm in most industries, but healthcare lagged significantly. And what we found was that many core elements of the electronic health record were not digital at that point in time, especially when we think about charts, notes that clinicians were capturing. Many of those things back in 2002 were largely paper-based. So you can think about hospital records being scribbled down on paper. You can think about less than a quarter of docs, far less than a quarter of docs at that point in time having electronic records. You could see some aspects of information digitized at that point in time. Problem lists. There was a certain amount of digitization that was associated with billing practices. Things like lab results and medications. Pharmacies, for example, and laboratories were among the first to digitize. So you saw digitization creeping into the system, but much of the really important information was in a paper format. Then if we fast forward to 2022, on the next slide, we see a very different picture. So from the bottom, what we see is that a lot of that data that resides in hospitals, in primary care community settings, is now a digitized format. Much of it still not standardized. And so I think we all recognize that big block at the bottom there that says primary care summaries, that represents a massive portion of the health information in the country is locked up in primary care and community-based organizations. It's clearly not available. It's clearly not something that you can draw on for artificial intelligence today, but the jump from it being paper-based to it being a digital format is a huge jump. And we see incremental improvements in the digitization of that. We also see things like medications, imaging results, many of those important core elements of the electronic health record moving up that chain, being increasingly standardized, increasingly exchanged securely. So that being a next sort of a tier in terms of the hierarchy we think of, and then patient access to information, which is of course growing. Lab results and immunization information being key and now being largely available. But we see things increasingly moving in that direction. So there's I think overall a good story in terms of the progress we've made. Lots to be done, but I think one of the big messages for us over the last couple of years has been recognizing that the foundation that's been built by all of us over the last 20 years has been a very important foundation for where we find ourselves today. Some of the data points that help inform this, and again, I'm not going to dive into this data, but we have a lot of data that is available to all of you and to all the entities across country driving digital health. And so we try and make this as available as possible. The left-hand side is some data from our Canadian Physician Survey. So this was a national physician survey conducted with the Canadian Medical Association. It looked at a variety of questions. This particular one looks at electronic communication tools, just gives you that snapshot of, access to lab results and diagnostic imaging, pretty readily available in an electronic format for the majority of clinicians. And then as you start to go down that list, you start to see the kinds of electronic communication that we'd really like to see, electronic referrals, sharing of clinical summaries, things like that, available to around a third. So that's a really good snapshot in terms of where we're at and those sort of day-to-day lives of clinicians try to use health information. The right-hand graph, and I should say all of that data we make available on Dataverse, which we partnered with UVic to get started up, which makes the full data set available. We also make it available on our Insights site, which Bobby will share with you in a few minutes. The right-hand side is a trend graph of progress around primary care electronic medical record adoption. This has been a big thing for InfoWay, and our mandate is driving this number up, and it's driven up quite significantly in the last 2 decades. The green line at the bottom is clinicians' reported ability to share clinical summaries. And what you can see is that lags quite a bit, and the trend line there is not nearly as steep as the EMR trend line. So this for us is a bit of a burning platform, and a lot of InfoWay's work these days is shifting towards interoperability. So we've got a lot of this foundational infrastructure in place, but the sharing has not followed. How do we shake that loose and get that movement going? On the next slide, what we've got is the number of Canadians accessing their data. And so that's up to now 1/3. And this is the portion of Canadians in our national survey, which Bobby will share a little bit more with you about, portion of Canadians that report that they have accessed at least some portion of their health record. And this number has grown dramatically over the last decade, and a very important mandate to move forward. Much of this is still access to lab results. Some of these folks are accessing a more rich history or set of their notes, but this has been a gradual process. The most important thing, though, in my view, is that the culture around healthcare and the expectation of Canadians has moved dramatically. And the Canadians want this data, they expect to be able to have access to this data, and there is now really a growing consensus within the healthcare community that's the right thing to do. And I have to say that a decade ago, that was not where the conversation was. There was a lot of hesitation about opening up records to patients. And I think there's now a clear recognition that that has to happen, and it's a really important part of care delivery. And we're starting to see those numbers tick up. So this for us is a really important indicator, and we look forward to seeing this one grow over the years. So this is a slide that I wanted to share because it gives a big picture snapshot of where we see the important work going forward in InfoWay. So as I said, a lot of our work these days is focused on interoperability. If you look at Prescribe It, which is really all about making sure that there's good communication between prescribers and pharmacies, that's an interoperability problem. If you look at a lot of the work that we're starting to do around electronic medical records, hospital systems, all that work, it's all about sharing information. And the value proposition that has largely been discussed and which I've talked about thus far is really the left-hand side of this. So it's, do clinicians and patients have that access to data in their hands at the right time? Are clinicians able to collaborate effectively over transitions of care? Can those key elements of that patient information end up in the hands of the right provider at the right time? Can patients use that data effectively, understand that data? That's been a primary piece of it. But as you all know, I'm sure, because you're all attending this course, that's not where the value proposition ends. And in fact, the right-hand side of this is a really important part of that value proposition. And in hindsight, something that I think maybe at InfoWay a decade and a half ago, we should have put more of an emphasis on, because this piece of it has been harder to unlock. So when we look at data to inform health system planning, when we look at data that informs innovation in our health system, these have been big hurdles to cross. We've made big strides on the left-hand side, continuing to make big strides on the left-hand side. We need to put a real push on the right-hand side. And I'm sure when you heard from Eric Sutherland, he would have been talking lots about the Pan-Canadian Health Data Strategy, the importance of that vision, the importance of the right-hand side of this. We are fully on board with that vision, that notion that we need to move forward to this world-class health data system, and the need to build the fundamental pieces that build towards that. One of the big findings for us over these 20 years that we've been working on this agenda, the technology is a really important part of it. But the two slides I showed earlier about where we were 20 years ago and where we are today, if the technology was the only problem, those things would have been bubbling up really quickly. But what we recognize is that culture, legislation, change management, reimbursement, all of these things are major factors that have been huge limitations to where we're at with the right-hand side of this diagram. And for us, that's the big burning platform. So we're trying to make sure we're out there, we're telling this story about the importance of what's on the right-hand side and the importance of unlocking the data assets that we have available today. Next slide, Bobby. So the last piece that I'll speak to before turning it over to Bobby is the role of our team at InfoWay. And so this is going to be a little bit into the weeds, but it's just letting you know how we function, and hopefully maybe a bit of a window for some of you about the role of analytics within digital health and the role of analytics to drive forward digital health. So our team really has three major functions. The first is business case phase. So at the beginning of the work, and I think in many ways we see this next phase of interoperability as being in this phase, because we're reestablishing a business case for standardization, sharing of information, availability of information. And what we're doing in this phase is describing the current state, what are the trends of adoption, where have we been, what does the trajectory look like, and making sure that we have a really clear value proposition. So we're doing a lot of work in the interoperability space in this area, understanding, how much time is wasted by patients, how much time is wasted by clinicians, what are the kind of patient safety issues that occur when we don't have a clear sharing of information across settings, those kinds of things. When we get into the performance measurement section, we're talking about how do you effectively manage a program that is on the move. And so a great example for this is Prescribe-It. So Prescribe-It is an electronic prescribing service. It's live in a number of jurisdictions right now with significant volumes of prescriptions flowing. And the really important questions for the Prescribe-It team are, how do we increase volume? How do we bring on new users? How do we make sure that the user experience is a good one? How do we address quality issues, continue to improve quality, address user issues, continue to improve user experience? So what our team does in that case is a lot of in-the-weeds support for them. Dashboards that are built using the data from the Prescribe-It system, surveys of clinicians, surveys of pharmacists, surveys of system users to understand those user experiences, those barriers, those challenges, and feeding that back into the real-time day-to-day operation of the Prescribe-It team, who are out there rolling up their sleeves every day and trying to get out there and improve this system. So this is a very different function that you can see from the first business case function, but the importance is that there's a link there. And the link is a really important one, because when we're at the business case phase and talking about where we need to be, we need to build that into the performance measurement of the system. So the business case phase for Prescribe-It said, hey, you know what, we need to get all pharmacists and all physicians on board with this. The performance measurement piece of that is trending. Where are we? How many do we have enrolled? How many do we have live? And how many do we have with them using Prescribe-It as their primary prescribing metric? So the business case and the performance measurement have to tie in. And then that ties to the last piece of the puzzle, which is the demonstration of outcomes. And so this is a really important loop, because at the end of the day, we want to make sure that we have in fact demonstrated the outcomes we were talking about at the beginning. And this is one of these things that often gets lost. Often great things are put in a Treasury Board submission or a grant proposal about the wonderful things that are going to happen, but at the end of the day, the circle back isn't done. And one of the things that's been really important that we've realized over the years is that the kind of benefits that we talk about, the kind of benefits that I just showed on the previous slide, those do not necessarily materialize without concerted effort. And for me, the story of the electronic health record investments is a great example of that. All of that infrastructure, all of those inventories, all of the availability of that data pushed forward, made some important changes to the healthcare system, but started to lag when we got into the point-to-point sharing of information, the health system use or innovation use of that data. And so for us, there's a big element of, you must loop back to that value proposition, understand what has come to pass, what has not come to pass, and recognize those lessons learned and next steps to complete the cycle and revisit it. So that's a bit of the story about how we fit into the organization. I'm going to turn it over to Bobby now, who's going to share you a bit more in the weeds about what our team does. And then really, I'm looking forward to a great discussion and hopefully some challenging questions about how we can all move this forward together.
Perfect. Thank you very much, Simon, and hello, everybody, and thank you for the opportunity to speak to you today. As Simon mentioned, I'm going to dive a little bit into one of our main products and our main communication channels for disseminating some of the research that Simon's alluded to, and that's our InfoWay Insights website. which has been up and running for about a year, just over a year now, and has been quite successful in making our research findings more accessible throughout the country. So just to give you a little bit of a sense of why we built this site, for many years we've conducted research. We've partnered with research firms to do large landscape studies to gauge awareness, attitudes, adoption of digital health tools, by asking Canadians, by asking clinicians like physicians or pharmacists or nurses, to really build that health system landscape view. And typically we would compile those results. We would develop PowerPoint slides. We would have webinars to share that data. But every time we did that, it would require significant work effort, significant time to turn around those analyses and to develop customized views. So as the demand for this data grew and more entities found out about the research that we were doing, we were starting to really have trouble keeping up with the amount of customized queries and presentations in order to meet this demand. So what we looked at was to develop some kind of an interactive platform that we could present our data, make it available, and allow users to interact with the data and customize the views based on their particular needs. So, for example, we have a lot of stakeholders in the various provinces across the country, across the territories, and they're interested in data pertaining to their population. So one of the main use cases is to allow for filtering of our data by province in order to provide those stakeholders with their own customized views. And as well, we wanted to present different views based on demographic variables, based on particular health conditions, and all kinds of things, which I can demonstrate later on when I'll give you a walkthrough of the actual site. But we wanted to make all of this data easily accessible and also be able to showcase some of our research, some of our partnerships, and provide some thought leadership in terms of how we can model some of the benefits that we've been harvesting. So in terms of how we developed this, first we started off with the concept. We worked a lot on user interface design, a lot of mock-ups. We had to obtain the buy-in of various groups within our organization because we are developing something that would be publicly accessible. Then once we came up with the basic concept, then we looked at development, pre-processing of the data, developing the actual site. We decided on Python Flask as the development frameworks. We had to build in responsive design so that you can access, you can view the site properly on all kinds of screens, be it on your laptop, be it on your phone, various monitor sizes. So as well, there were a lot of learnings within our team and our developers for how to implement some of these development principles. The same with making the site accessible We had to comply with the Accessibility for Ontarians with Disabilities Act. And that was a really important process, not only to make the site accessible, but it ended up making the site more usable for everybody, as well as improving the performance of the site. And it was very much an iterative process. So we started off with putting up the results for one survey in a very basic format. And as people started using it, as we learned more about how to develop the site and implement more features, then we added more functionality. We worked on aligning the look and feel of the site to our corporate website. So now that they look like they're part of the same organization and can flow seamlessly from one site to the other. So this is just a little snapshot of the main digital health research page. We currently have data for 3 large landscape surveys. The Canadian Digital Health Survey, where we have trending data going back 4 or 5 years. We have a National Survey of Physicians, which we conducted last year, and also a COVID tracking survey, which is a series of questions that we asked on a bi-weekly basis since the start of the pandemic, tracking virtual care use. So we've put up all that data in all kinds of different formats that I'll walk you through, and made it available to everyone. As well, we're proud to also showcase our research collaborations. So we've created a page here with an interactive map of where you can see where our research partners are located and provide links to some of their work. Again, to show that, to make this research as available to our stakeholders as possible. And I mentioned the site has been up for just over a year, and we've had some, frankly, amazing success with the take-up. So we've had nearly 4,500 users access the site from every province and territory across Canada, and it has a reach in 60 other countries, which frankly blew us away. Just to see how broad the interest is in some of this data. So I put up the link here, and I'm going to step away from the slides for just a second, so I can actually give you a little bit of an overview of the website, and then give an opportunity for people to ask questions. So let me just put it here. Okay. So this is the site, InfoWay Insights, and right away our homepage features the research that I talked about, as well as some additional sections featuring some of our in-depth reports from over the years, partnerships with our researchers, and an opportunity to sign up for InfoWatch newsletter for those of you interested in keeping up with the latest digital health research. So I'm going to give you a little bit of a tour. We'll start with the digital health survey. And this is a fairly large survey. I think we had somewhere in the vicinity of about 80 questions last year. So we've categorized the data into different sections, and we can start here with virtual care use. And we see here, and I apologize, this is very tiny, but I promise if you open it up on your own screens, you'll be able to see this in more detail. but we ask Canadians about their interest in electronically enabled health services, and then as well their access. So you can see Canadians are generally very interested in digital health services, but when it comes to actually accessing them, that percentage is significantly smaller. And again, we also ask about their use in the past 12 months, and we ask about where they're accessing these services, as well as their experience. So a ton of data, and this is just one section. We can go into here into very, very different sections, like for example, prescription data. So these are all the questions related to electronic prescribing. And what we have here are things like, have you filled the prescription in person? Have you renewed a prescription? And the frequency of each, as well as some specific questions around prescription delivery methods, opioid prescribing, your experience with picking up prescriptions, and so on. I can go on all day with the different topics. What I wanted to show you was our filtering ability. So I mentioned earlier that we allow users to filter by, let's say, their jurisdiction. So if we wanted to see results just for BC, we could filter it here, and then that would reduce the sample size to just BC respondents. And you can stack filters one on top of the other. So if you wanted to, let's say, look at those in BC with chronic condition, we would select it here and continue to stack. So if you wanted to see those with a chronic condition, let's say who were unemployed, then you would be able to continue to filter to the relevant sizes. So that's pretty much the functionality of the site. And if we go to, let's say, a different survey, it's a pretty similar experience. We've got here for the physician survey, we've got a breakdown of digital health use, for example. So you can see use of EMR, use of various electronic tools. So these are some of the breakdowns that Simon featured in his presentation. And in addition, we've got access to data tables. So if you wanted to run a customized analysis, you wanted to download the data, you can download a full question set, or you can download banner tables for specific questions on the survey. So again, depending on the audience, some may just want to see very high level stats. Some of you may want to dive into the data. Lastly, I wanted to show our map of research partnerships. So I mentioned here we can feature where we've got some of the researchers that are close collaborators, and you can highlight here. You can read a little bit more about the researchers, and we've provided links to some of their most recent work. So with that, I'll go back to our slides just to finish up, and then hopefully take some of your questions. So here's a link to the site itself, and if you're interested in our staying in touch with our latest work, we've provided some links here: the Insights website, ongoing evidence that we publish. We've got our benefits evaluation collaboration network, which is networks free to join. It's we put out webinars around quarterly with topics of interest to the digital health community. And I mentioned before the chance to subscribe to our Digital Health InfoWatch newsletter for the latest evidence and webinars and additional resources related to digital health. So on that note, I will open it up for any questions, and Simon as well, if you have any additional comments to make. But that's the end of our slideshow.